Hi, my name is Lisa Sissel, and I'm going to be the nurse today inspecting my husband, Mr. Vick. He has given me permission to disclose his identity. And I'm going to be inspecting his head, ears, eyes, nose, and throat today. As I've entered the room, hi, my name is Lisa. Nice to meet you. While I'm talking to him, I'm going to explain to him what I'm doing. I'm also noting his symmetry, his facial expression, his mood, his posture, his attire for this time of year. I've got my supplies at the bedside. I've already washed my hands before I came in, but I'm going to wash them again just to be double safe. I tested his level of consciousness just in the greeting with him. Assess for any lesions, among the face scars, anything very obvious. I'm going to go ahead and start with the head. Now that I've done all of my assessment, I'm going to go ahead and inspect. Okay. I'm going to check the head for any kind of depressions, lumps, all along those skull lines. Checked the shape of the skull. I've checked hair distribution. Again, any lumps, bumps, depressions, anything like that. I'm also going to check that temporal artery. I'm going to go ahead and check it on both sides. Make sure that's there. I'm going to check for TMJ. Go ahead and open your mouth and close. Okay. Perfect. Thank you. I'm going to check those sinuses as well, noting any pain or any pressure on those sinuses. Looks like no. Alrighty. Now I'm going to perform the eye exam. So of course I always start with assessment. I'm going to look and make sure that those pupils are round and equal. They're symmetrical. That sclera is nice and white. I'm also going to note the conjunctiva is nice and pink for me. I'm going to check the pupils for reaction. I'm going to check interocular muscles. I'm also going to do the red test. So let's begin. I think I'll start with just the light and check for reaction. I'm going to have you look straight over my shoulder. Checking. Perfect. One more time in this ear. Eye. Checking for reaction to those pupils. Constriction. Perfect. Okay, I'm going to have you look straight over there. I'm going to have you look at my object up close. Do it again. Look over there. And up close. Okay. Now I'm going to check those peripheral vision here. Tell me when you see my fingers.
Yep.
Perfect. Tell me when you see my fingers.
Yep. Yep.
Okay, now I'm going to have you just follow my finger. Okay. Move your head, adjust your eye. I've done the star pattern. There's also an H pattern that can be done. And I'm going to follow it. Perfect. Now I'm going to go ahead and perform that red test. I'm going to stand a little bit at a distance away. And I want you to just look straight ahead. I'm going to line that up with your eye. Good. I'm going to look in and I should see a red dot around his eye and then a reflection back to me. Okay, and I would do that on both. Perfect. Do that on both sides. Now that I've performed that, I'm also, assessed to make sure there was no foreign bodies earlier. And then I would do a Snellen chart. I don't have one in my home, obviously. So I would have him stand 20 feet away from the paper. And I have him cover up one eye and read to me the lowest line he could. Then I have him do the other eye and I would check both sides that way. Now I'm going to move on to the ears, noting symmetry on both sides, checking to see if there's any obvious swelling, redness, deformity on the external canal. And then I would use my wonderful otoscope and check on the internal canal. And then since this is an adult, I would pull up and back. And the book says upside down. Some of the other resources say up. I'm going to do it this way. That way I can see good. And I'm going to note the tympanic membrane is a nice pearly white. Checking the canal for any drainage, swelling, anything like that. And I'm also going to check this side. Okay, now I'm also perform the whisper test. So I'm going to plug one side of your ear and then I'm going to say a 2-syllable word and have you repeat it back. Okay. Perfect. And I'm doing on this side as well. Perfect. And that concludes the ear test. Now I'm going to be performing the nose test. Look on the outside, inspect. I'm going to look inside. I'm going to check for patency on both sides. Checking that septum, making sure that it's midline. Checking the mucosa, the turbinate, and noting any drainage. It's incredibly vascular in there, so it should be nice and pink. I'm going to inspect the mouth and lips. On the outside, I've noted there's no hepatic lesions, no swelling, crusting, dryness, anything like that. Now my patient opened their mouth for me. I'm going to look in. I'm going to have them say, ah. See back there. This tonsil. Okay, and noting the inside palate, soft and hard, the mucosa, the tongue, the teeth, and symmetry of both sides, the tonsils, the gums. And that concludes the mouth. Now I'm going to inspect the neck. Just looking for obvious deformities, jugular vein distension, goiters, anything like that. And then I'm going to go ahead and I'm going to palpate different lymph nodes. So they should be about pea size. I'm going to use my 2 fingers to palpate around. Should be easily movable. Okay. So I'm going to start with the preauricular right in front of the ears. I should be always checking both sides to make sure. And then the submandibular. And then the deep, I'm going to have you turn your head that way for me. The deep cervical, and you may not feel that one, and don't always feel that because it's deep. Okay, perfect. And then I'm going to check the post-cervical. Then I'm going to do a technique. I'm going to stand behind you and I'm going to palpate that trachea, find that cricoid cartilage, make sure that's midnight. I'm going to have you swallow. And then I can make sure that it's midnight and check that all the way down. I'm checking the thyroid at the same time while I'm down here.